Good morning, everyone. I'm Robin Shapiro. I'm the board chair of Health Advocate X. We're delighted to have you join us for this webinar today on health literacy, the new vital sign. Before we start, I would just like to thank our program co-sponsor, Campaign Zero, and Karen Curtis, the CEO and founder of Campaign Zero, will be joining us at the end of the webinar to have a few remarks. And I'd like to also welcome our speaker, Sue McWilliams, who is a longtime educator and professor at Northern Arizona University School of Nursing. Sue, thank you so much for joining us today, and we look forward to hearing your presentation.
Well, thank you, and good morning, everyone out there in Zoom land. I appreciate you all being here this morning. As Robin mentioned, I do teach nursing at the Northern Arizona University School of Nursing, and I teach health literacy to our traditional students, our undergraduate students, because we feel it's really important that they have this information as they begin their new careers as nurses. But I had a conversation with Karen Curtis about this, and we thought it might be a great opportunity to also share it with health advocates, since you are working closely with patients and caregivers and the health professions. So I thought we would give you guys a quick overview and some insights onto health literacy, the new vital signs.
And I just wanted to pop in there real quick and just say, we will be taking questions at the end of the presentation. You can put them either in the Q&A format or the chat format. And Sue will be answering those at the end of the presentation. Thank you.
So just to kind of give you a little perspective, before we even dive into why this is so important, the average American reads at a 7th to 8th grade level, and the average Medicare age person is reading at a 5th grade level. And most of our literature that we provide patients with, whether it's discharge instructions or pamphlets that we give them in the doctor's office, are often written at 11th to 12th grade level. So right there, we're working from a deficit. And have you ever been to the doctor and not really understood what they're saying to you? I mean, I've been a healthcare professional for 40 years, and there are times when I will hear a new term or, be in the hospital supervising students, and something will come up and I'll be like, oh, I have to go back and look that one up because I don't really know what they're talking about. So things continue to change at such a rapid rate today. And so it's easy, even for us as professionals, to not always know what's being said. But for our patients and their caregivers, it really is a challenge. So let's find out what your health literacy is. The following quiz is based off of Pfizer's new health literacy quiz, which is available to anyone. You can download it, and the information will be at the end in the references. But this is a great way to kind of understand your own health literacy. And then from there, we'll build from that. So here's a quick question. I'll give you a few minutes. Now, if we were doing this in the classroom, I would have you take a little quiz, and I don't really score people, but we give out treats. But since we're in Zoom land, I can't give anybody treats. So if you eat an entire container of ice cream, how many calories will you eat? I'll just give you a few moments here to kind of think about it and calculate it. And if there are people that are interested in putting the answers in the chat, you can do that as well. Okay, here we go. And it's 1,000 calories. Next question. If you're allowed to eat 60 grams of carbohydrates as a snack, how much ice cream can you eat? Okay, ready for the answer? You can have 2 servings. I'll probably eat 3 or 4 myself, but I don't know, I'm an ice cream fanatic. And if you eat 42 grams of fat each day, which includes 1 serving of ice cream, If you stop eating ice cream, how many grams of fat will you consume each day? 33 grams. And if you eat 2,500 calories in a day, you'll be eating 10% of your daily value of calories. If you eat one serving of ice cream, true or false, can you have a serving of ice cream? True. And the final question. You're allergic to penicillin, peanuts, latex gloves, and bee stings. Can you eat this ice cream? And I hope all of you said no. So this is a great place to start when you're working with families and caregivers to kind of get an understanding of where they stand as far as health literacy goes. I'm going to show a quick little video here. This is Dr. Lisa on the street, and she's going to interview some people and ask them some questions that probably most people will have heard, but maybe don't quite understand.
I'm interested in raising people's awareness about health. And I also want people to understand that part of being healthy is also your responsibility because you need to communicate with your healthcare provider.
Right.
So today we're talking to people about doctor-patient communication and where it goes wrong. Because doctors often speak in a language that people don't understand. Has this ever happened to you?
Pretty much all the time.
Oh,
I'm not, I haven't went to school to be a doctor. I haven't went to school to be a nurse. So when you say it's using big words, I don't know what you're talking about.
I think it needs to be broken down
does
in
that
layman's
happen on
terms.
a regular basis?
Yeah.
Yeah, well,
What's that?
Not if I trust my doctor. If it tells me to take the pills, I take the pills.
Oh, so you don't ask any questions, you just
Sometimes I
take the
do,
pills.
sometimes I don't. Depends on what it is and which doctor I'm doing.
So just for fun, I have a few words here that doctors commonly say without even thinking about it. So I want to see if you know what any of these words mean.
Okay.
Exacerbate.
Injure,
exacerbate.
strained? I don't know.
Exacerbate.
Exacerbate. I don't know that word. Push beyond what it's supposed to be.
Okay. What about hypertension?
Mechanic set.
Oh, that's high blood pressure.
Lumbar strain. If your doctor says you have a lumbar strain.
That's pertaining to the back, the lower part of the back, yes.
Yep. What if the doctor tells you you have lumbar strain?
Oh, I would tell him to explain it.
Oh.
I would tell him to explain exactly what it is. Yes. I mean, if it's something that I don't understand, I have no problem with asking.
Yeah.
Yeah, I'm going to make sure I leave out there knowing exactly what's going on.
I think it's one thing is universal, that doctors need to learn to speak in a language that people understand. We know what these terms mean. These terms may be in the media. That doesn't mean people understand the term.
Aspirate? I don't know.
I'm not sure.
And it says he's going to aspirate something.
He's gonna withdraw something.
Right. What do you do if the doctor tells you to reduce your sodium intake?
Stop eating salt.
But you already know what to eliminate?
No, because there's so many other things with salt in it that just eliminating salt from your diet doesn't even come close.
So if your doctor tells you to eliminate salt, that's not that helpful, or?
Well, no, just because there's salt in so many other things that he needs to be a little more explicit.
More specific. Okay. Very good. And then finally, if your doctor tells you you have diabetes, what's going wrong with your body?
Oh shit, I don't know.
Sugar, cholesterol. Cholesterol?
So if you have diabetes, the cholesterol and the sugar are high, is that what you're saying?
Yes.
Yeah. So it's related to sugar. So diabetes is high blood sugar.
High blood, okay.
And it means that your body is no longer able to break down blood sugar. It's pretty clear. Doctors need to speak in a language that patients understand. But as a patient, it is your right to ask as many questions as you need to get the information you need to be well and healthy. I'm Dr. Lisa. I'll see you on the streets.
So I think there's some very important things that came up in that video. One, the number of people who didn't understand certain terminologies that we use on a daily basis. But the other thing that I thought was rather interesting were the number of people who just trusted what their doctor said without really understanding. And so you think about the patient who leaves the doctor's office, given some instructions or told about a new diagnosis, who probably don't really understand, but because their doctor said so, I trust that whatever they said is important, but I may not understand what I need to do when I go home. So the Institute of Medicine, Healthy People, and the Affordable Care Act all have a definition of what health literacy is. But what's important about all of them is that they all agree that there needs to be the capacity to obtain, process, and understand basic health information. So if you think back to our little quiz that we did in the very beginning, where we were asked to calculate calories, grams of fat, those things can be very challenging to someone who may not have the literacy level of someone who may have graduated from high school or even college. There are factors that we know that increase the risks for low health literacy, lack of educational opportunities. So many people, in particular with our baby boomers, may not have a high school education. They may have only finished certain parts of elementary school before they went to work or went off to war. So they may not have the educational level that some children today have. So learning disabilities, we do know that there are a fair number of people out there who have processing disabilities, dyslexia, cognitive decline. So certainly as we get older, as our brain changes and it begins to shrink a little, we do know that it's harder to understand and comprehend and then continue to hold those new informations. And reading abilities. So they really tend to decline over time if you're not reading on a regular basis. So in order to understand basic health information, you need to have intermediate skills. So you need to be able to really understand and comprehend and be able to summarize what you just read, maybe begin to make some decisions based on what you've just read, understand the purpose behind the instructions. So if you send someone home with instructions on how to care for a wound, maybe the family caregiver or the patient themselves may not quite understand exactly all of the components to those instructions. Being able to take a very complex document. So think about those pamphlets that you get with your prescription. Usually Walgreens, Walmart staple that little packet of information to your little bag as you're going home. And if you ever looked at the instructions in there, they come right out of the PDR. So they're very complex. And if you're not quite sure, you probably aren't going to understand maybe some of the side effects that might occur from a medication, or understand exactly all the different parts that go along with treating a wound or doing some sort of activity at home. So you can end up being injured. This is one of the reasons why we see people coming back to the hospital frequently after being discharged, is because they don't understand the instructions that they've been sent home with, or how to follow through with the instructions. So we do know that there are some cultural contexts to health literacy. Communication, belief systems, and values are very important pieces to this. Where I teach is in northern Arizona. We have the Navajo Nation. Hopi Indians are also very prominent up here. And they have some very specific belief systems around health. Some of the things that you don't discuss with them is death. They don't really like to talk about that. We also are very close to the Grand Canyon. So we get people from all over the world here. So if you have people from certain religious backgrounds, maybe if you're a woman And their belief system is that really it's men who have all the knowledge and are in charge. If you try to come in and have a conversation with them, they're not going to take anything that you say as being important. So you may have to take that into consideration. How people value their health. We know that certain cultures value health differently. So making sure that you understand who is it that you're working with? Have a conversation about how do they feel about health? What's important to them? Is being healthy an important aspect? Is going to the doctor an important thing for them? So having that piece there, and communication. Some people don't even like to talk about death or dying or illness. It becomes a very difficult conversation. So you really need to have that serious conversation, with your patient and the family caregiver in the beginning. So we know that age and poverty are leading causes of low health literacy. We know that currently there's, almost 5 million adults aged 65 and older that live at poverty levels. And that our aging population, particularly those 80 and older, have the highest poverty rate. We also know that Black and non-white Hispanics have a higher rate of poverty. And regardless of anything, poverty is just going to increase the risk for low health literacy. So not knowing all the different populations that you may be serving, one of the aspects that you may be looking at is if you're living in an area where we know you have a higher rate of poverty, you may need to look at that as being an important context to working with families and the healthcare providers so that they're aware that this may play a role in their ability to understand their instructions when they go home or to follow through with medical care. We know that low health literacy increases the risks for more hospitalizations and emergency room visits. If a patient isn't aware that there are things that they should be doing at home or that there are signs and symptoms that they need to be paying attention to so that they can contact their doctor right away. For instance, a patient with congestive heart failure who may not recognize that a 1 pound weight gain overnight is considered a serious sign and they should be contacting their physician. So those are kinds of things that will bring someone into the emergency room because by the time their symptoms have gotten much worse, they're no longer going to be able to just go to the doctor for an outpatient visit. Now they're on their way to the hospital. They're less likely to have a regular doctor or a healthcare home. They're less likely to go about and get their immunizations. Or have insurance. We also know that people with low health literacy tend to have comorbidities. So they probably have hypertension and diabetes. And they delay seeking medical care. Some of that is because of fear. Often people who have low health literacy, because they don't understand what's happening, they don't know how to ask a question, are really afraid to seek medical care. So this is a very interesting statistic. And as someone who's age 64, I found it very fascinating that 3 out of 4 patients will leave the hospital with an incorrect prescription or understanding their medication regime post-discharge. What this tells me is that 2 things will happen often when people go home. 1, they'll continue to take medication that had been previously prescribed that they are no longer supposed to be taking. And that may have consequences and side effects with whatever medication they're currently being prescribed. They may not know that they need to get the medication right away. They may not even have a way to get the medication right away. So if you don't tell your doctor or the nurse when you're being discharged that, well, gee, this medication that you have me on requires refrigeration and I live out on the reservation and I don't have electricity, that's going to be a huge complication. So it is important when you are working with your patients and their caregivers to make sure that they have a list of their current medications, that they understand why they're taking the medication. And if there's new medications that are prescribed, they need to make sure that they're looking to see if there's any interactions. So having that conversation before people go home with their nurse to say, look, these are the medicines I have at home. Am I supposed to continue taking these? Is there a particular way I need to store the medications? All of those are really important and things that as a nurse doing a discharge, you may not even be thinking of, partly because you're so busy trying to get everything done in the day. So that's why you as patient advocates, I think, are going to play a key role in making sure that a lot of these things don't go missed and that then the patients can go home and we don't end up with serious complications and readmissions or even sometimes death. So translation, please. I do a little thing with my students where I have them try and explain to each other certain medical terms. And it usually ends up being quite hilarious because they're so focused on learning these new medical terms that they forget how to talk like a regular person. So, things like decubitus ulcer. Well, if you're not a healthcare provider, you may not know that's just a bed sore. And those can be very dangerous. Heart failure. Of course, if you say heart failure, that, is a very serious term. And I love this thing. Oh, I'm about to die. But just thinking about all the different kinds of terminology that healthcare providers use on a regular basis, the jargon that we use every day, it's oftentimes difficult to translate back into regular language that most people can understand. So I do have my students practice this. So one of the things you might want to do is take a list of medical terms that you feel very comfortable knowing what they mean and figuring out how can I make this a much more simpler thing to say to someone. So one of the things that we have found recently is social media has been playing a very huge role in healthcare and providing information. And sometimes the information isn't accurate. And so I think it's important that we discuss this whole idea about social media. So this is just a little trailer from a thing called Cyber Seniors. I do have the link for the full video at the very end, which is over an hour, so that's why I'm not showing it here. But this is a group of young high school students who are working with senior citizens to learn how to use the internet and social media. So just a little quick tease here.
Is there anything you would want to learn from the internet?
Could you explain a bit about this Facebook something, okay. and you're having to be a friend?
I typed in www.email.com.
Yeah, that's the problem.
Have you ever heard of YouTube?
Yes, I've heard of it, but I have no clue as to what it means.
How many people here have used a computer? Well, we have some teenage volunteers who are willing to teach you how to use the internet.
I think I'm too old.
Hope you have lots of patience, Henry.
Today we're going to go on Facebook. Do you remember how to get there?
Well, I think I just, no.
All these things that I never even dreamed about.
I love it.
Welcome to a whole new world of information.
Every time we're together, Shreya just wants to watch cooking tutorials on YouTube. There's a big game called Minecraft. Maybe we could cook something that looks like one of the characters in Minecraft.
Hi, everybody on YouTube.
We should have you doing a music video.
My teeth are as fresh as hot popped corns. My OG teeth.
All of the other seniors are so inspired, so we're going to have a contest to see who gets the most views of their YouTube video.
Hello, YouTube.
Hello, YouTube. Hello, YouTube.
Today we are talking about travel.
Music.
Sisterhood.
Million Evelyn's is beating mine. I need more hits on YouTube.
This is the big moment that you've all been waiting for. The first prize, winners of the Cyber Seniors competition, goes to...
We all know how difficult it is to learn something new, but we really do feel that it can change your life.
So you got a friend request from...
Leo, who's he?
He's in the same program.
Hold on a second, you got a message. Sure, Edie. Hello, Ellard.
Oh, dear.
Look here, Ellard is typing.
Oh, hello, Ellard. Hello, Shura.
Megan said, thank the people who taught you.
You're welcome. Love you. They see a program like this and they think it's an opportunity to get in touch with their grandkids and to communicate.
No matter how old we are, we do need a purpose for getting up in the morning.
Is there anything?
So it's a really wonderful documentary if you ever get a chance to watch it, and gives you a really great perspective of senior citizens. And a lot of these people are certainly well into their 80s, but how important it is to get them to understand how to use and access the internet and social media. In particular, since half of the people that are using the internet are between the ages of 50 and 64, and people that are 65 and older are the ones that are mostly using things like Facebook and that today. And they're more than 4 times likely to share fake news on Facebook. I think that's an astounding thing to understand, that so much of what happens every time someone shares a little piece of information on Facebook, and it gets disseminated amongst all these people, and it's fake news, which is one of the concerns that we have today with the number of people out there using it. And you know, things that can occur, such as, you know, the information that's being presented about, you know, the current pandemic, treatments for the pandemic, or even treatments for common ailments that many older people have, arthritis or diabetes and that. You know, 80% of consumers go online to find out their health information. And if you look at 66% of Americans are using the internet to find out about their diseases or medical problems. And there's a lot of information out there that isn't accurate, is misleading, and oftentimes is really only there to help them buy a product that probably will do nothing for them in the end. There's currently an FDA watch right now regarding COVID information, information about treating COVID and the COVID vaccine. So the FDA is really watching this right now, because it is a significant problem for a lot of older people who are very concerned about getting a vaccine or even being out in public. Which leads to this idea of misinformation versus disinformation. You know, misinformation is information that may not intentionally be false. It tends to be widespread. I'm sure some of you have probably seen friends and family sharing things on Facebook or on Twitter. You may have even received some emails or some YouTube videos. And so there's just a lot, and a lot of it tends to be around health. The disinformation is more information that is usually political, reputational, or financial. I think we saw that in, you know, we've heard about it in the 2016 campaign. We've seen some of it in the recent campaigns. And it is a way to erode consensus. It is a way to break down and put in this sense of fear and disbelief in certain systems that we have in the past found to be, you know, important, such as our public health providers. And it's also difficult to trace. So oftentimes these are coming from foreign countries and or going through different servers, so that we can't figure out where they're coming from, which makes it very difficult for us to stop the information from coming in. So some of the things that you'll see in particular for misinformation are unproven cancer cures, you know, information about vaccines. We have a considerable amount of people out there with anti-vaccine YouTube videos. There's a particular woman from Michigan who has a YouTube video, and you watch it. When you're all done with it, basically what she's trying to do is recruit you into her what she calls her vaccine awareness courses, which are extremely expensive. And much of her information is not based on science. Baldness cures and weight loss are very frequent pieces of misinformation. My mother-in-law, who is almost 80, who has some cognitive issues, I often hear her on her phone listening to ads on Facebook about how she can lose weight by taking this, take this miracle cure and you can lose weight. And she's asked me several times to help her purchase stuff, and I've had to redirect her to say, well, I don't think that's really going to help. There is no magic bullet to help you lose weight. It's just eating right and exercise are really probably going to be better for you. But it's very easy to get sucked down into that little web of lies that they have. Some of the disinformation campaigns that are out there, 5G has caused the coronavirus. Mr. Gates is out there, putting nano microchips into us with the coronavirus. I have had people ask me about that. Well, the vaccines they're creating they're gonna be tracking us. And I ask them, do you have a smartphone? Well, yes, I do. I have this great iPhone here. Well, do you use Google? Yes. Do you go to the grocery store and use your little discount card? Well, yes, I do. Well, all of those are ways that we get tracked all the time. So we don't need to implant little nanoparticles to track us. And then the idea that Big Pharma knows how to cure cancer and they just aren't doing it because they want to make lots and lots of money. Those are disinformation campaigns and can be very harmful. So there's some things that we can do to kind of help counteract some of these things that are happening. And I'm sure as patient advocates, you have probably been asked certain questions or been told, well, gee, I just saw this on Facebook and I'm really concerned about going and getting the COVID vaccine because I've heard that it's, causing people to die, or, that there's people having mass, strokes and all these terrible things that are happening. But there are things that we can do to counteract that stuff. And some of it has to do with just providing some facts. So if you can just take one piece of what they're saying and replace it with some real information, some correct information, typically what will happen with that is that it now puts a little bit of doubt into their belief system. So now they're being told, well, here's the facts. This is what we know. Over, 300 million people have now received the COVID vaccine, and there really have been very few deaths. I think it's like less than 0.10%. So that gives them that little bit of doubt. I think the other thing too that our social media people need to do is to begin to provide more warnings that maybe this information is not factual. I think Facebook and Twitter have now done some fact checking so that if something comes up and it's not accurate, they do put a little warning sign on there. And then repeating the information over and over again. Public health officials, this is one of their biggest roles. This is what we teach our nursing students about public health, is one of our roles is to go out there and provide the information in multiple different ways all the time, so that having signs on transportation, buses, having it available as advertisements on TV, in social media campaigns, things like that, making sure that it's everywhere so that people can see it all the time. And it should be simple. I think sometimes we get carried away with trying to explain too much, but just keep it simple, just the facts, ma'am. Also, trying to induce some skepticism. So, if they tell you, well, gee, I heard that this vaccine is going to have nanoparticles and they're going to be tracking me. So ask them, well, why would this need to happen? Why does Bill Gates need to track you? Do you think that really this is happening? So begin to have that conversation with them. Also begin to get them to understand that, there is science behind much of what we do. Get them to start reading some of the science. And then if you have partners or trusted influencers, encourage them to also help spread the message. I know for young people, it's usually whoever's the hottest pop star, or whoever's the youngest movie star out there. But for some of our older people, having our past presidents come out and talk about the fact that, yes, they've had the vaccine, they think it's important that everyone get the vaccine. Having people that we know that older people are going to be attracted to, using them as influencers is extremely important way to counteract some of what's been happening and, providing these mass misinformation campaigns. So it's really important to understand a lot of the skills that are needed in order for people to have adequate health literacy. They need to be able to access healthcare services. I think that was one of the most important things about our Affordable Care Act, was that more people were able to access healthcare than before. Being able to analyze the risks and benefits. So if someone's being told that this particular treatment is being offered, what are the overall risks? What might they expect? What are some of the side effects? And do they understand what that means? Based on the benefits that maybe, knowing that if you take a new blood pressure medication, it might cause you to cough, but it'll control your blood pressure better, which is going to improve your kidney function, so that maybe over time it doesn't damage your kidneys and then you don't have to be on dialysis. So having those kinds of conversations, or maybe the risks are too high and the benefits are too low, and having them be able to analyze that. Calculate dosages. I think one of the things that our little quiz that we took at the very beginning, can you calculate something? That might be very difficult. So if they can't calculate a dose, then that needs one to be a part of the prescription, so that the pharmacist knows that this person needs to have really accurate information on how they are going to use this medicine. Being able to talk with their healthcare provider. That's one of your biggest roles. Can they communicate with their healthcare provider? I use my mother-in-law frequently as an example, because she is an aging person with multiple medical issues. So we never let her go to the doctor by herself, because she doesn't understand a lot of what he's saying. She has a hearing loss. So she doesn't always know how to communicate what's going on, within her own body. So having her maybe practice a little bit before she goes is really important as well. I think some of the other things that we can think about, sorry about that. Can you understand the test results? Sure, they might say that they're, fortunately, some of them will tell you that they're high, but what does that mean? Is that a good thing or is that a bad thing? Where can you get health information? So if you have trusted websites, maybe you can include that in some of your information that you provide to your family and to the caregiver and to the patient. Is it easier if we create something that's visual? So having pictures showing someone how to do a particular treatment, is that a better way than just giving them the words? Can they figure out, is what they're seeing, reading, being told, is it credible? And helping them begin to kind of understand, how do I know if something's really a credible source? Computer literacy. I think that was one of the great things about the Cyber Senior Program, is helping these older people learn how to use the computer and how to access the information. And, can they take the information and is it relevant to them? I think sometimes we don't always understand that something that might be important or relevant to me may not necessarily be relevant to a patient. And of course, numbers. I think that's one of the biggest things. Do they understand all the numbers that we're being given? And especially, today with the number of people that are on multiple medications, if they're diabetic who's on insulin, do they understand, what it is that they're having to do as far as making sure that their dosage is correct? Do they have a sliding scale? What does that mean? What does a sliding scale mean? Getting them to understand and being able to tell you, oh, I understand that if my blood sugar is this number, then I need to take this much insulin. So having those kinds of conversations and really drilling it down. I think the other piece to this that's so important is helping people recognize that it's okay that they don't understand the information that they may be given. I think the gentleman in the video with Dr. Lisa who said, well, if I don't understand it, I'm going to make the doctor explain it to me. I would say that probably the majority of people won't do that. They'll just listen to what the physician or the healthcare provider says, and they walk out of the office not really understanding. And making them understand it's okay to ask questions. It's okay to say, you know what, I really don't understand what you're telling me right now. Can you maybe try and explain it a little bit differently? And as a healthcare advocate, you can, I don't know how many of you actually go with your client to a physician's visit. Maybe that's something that's extremely important so that you can be that other set of ears, so that when you walk out of the office, you can do a quick debrief. So do you understand what the doctor just told you? He just gave you this information. Does it make sense? Do you think you can do this treatment? Are you okay with the risks that are involved with getting this medication? So all of those are things that you as a health advocate are very capable of doing. So I do have references here. Like I said, the Cyber Senior video is available for free. I just highly suggest you watch it. I think it's a great primer, especially if you're going to be going out and talking into the communities. It's a great way to get people to understand that they're important parts of our community, and that we need to be able to give them the opportunity to learn how to use the internet properly. Health literacy and challenges in the aging population, I think that is really one of our key areas that we need to focus in on is, our aging population. There are a lot of us that are baby boomers out there. We're the ones that are accessing healthcare on a regular basis. So we need to focus in on that. And I also put in there where you can get the Pfizer quiz. I think it's a great tool. I think we should be spreading that throughout all of our doctors' offices so that they can start using it as a tool with their patients, so that they know what's going on. And I think as advocates, we can be the people that can bring this to their attention. So thank you all so much for listening. And I think there are some questions out there, and I'm going to turn it back to Robin to kind of lead us through that piece.
There are some questions, and we have a good amount of time to take them. I think that one of the things that came up for me, and also I think it was Linda Beck who had talked about this as well, is the teach back method, which a lot of advocates are very familiar with. But do you want to talk a little bit about the teach back method, Sue?
Yeah, I think that is really one of the best ways to see where your patient or client is. If you teach them a new skill, or the nurse is getting ready to discharge them and they teach a new skill to them, can that person turn around and explain what they're doing and do it properly? I do believe, and I think it's a hospital in Texas, where they actually video the instructions and the procedures for the treatments to take home so that they can rewatch it when they get home. Because even though you may be able to do it right now, in that drive home, and getting back into your house and seeing the pile of mail that you have missed over the last couple of days, or the unanswered, text messages or voicemails and things like that. It's really simple to forget. What did I just do? So I think that's one great way of doing it. If they can make a video, almost everybody has a smartphone with a video. If not, you probably have, in particular for our seniors, an area on aging. They can help seniors get access to tablets and things like that so that they can have access to videos and things like that. So there are some great tools out there. But yes, Teach Back is an important method.
And I think, one of the things that's this very simple way to do Teach Back kind of on a smaller scale is just tell me what you heard, or based on what we just, our office visit, what of what you just heard, are you most concerned about or excited about, or show me, when you get home, because a lot of advocates will be, obviously, they'll be there with the provider in the visit, but they'll also be with their client in their home. You can always say, show me how you get out of the chair, show me which pills you took today, tell me, so that's all part of that. It's, when I do talks, I often pull up, do you know that show House? That's the doctor from a long time ago. And there's a hilarious video I recommend everybody look at. And he basically says, so whatever the patient's name, why don't you show me how you've been using your inhaler? And she says, what do you think I am, an idiot? And she goes and she's like, I've been using this twice a day. And in the video, she basically is putting it behind her ear. So I think that's the perfect example of the Teach Back method, is just, just asking that. So we do have some more chat and a question from Michael Wood, who is actually a board member of Health Advocate X. And it says, since the vast majority of people in healthcare situations aren't health literate, what is the role an advocate should play in healthcare decision making?
So I think one of the things that we talk about, especially with my students when we teach them in hospice and palliative care, which is an area where, oftentimes you're having to have discussions about treatment plans and end of life discussions. One of the things that we recommend is that you just maybe have the conversation, about what, and kind of with the Teach Back, what have you heard? What has the doctor said? And what are your goals? What do you want right now in your life and in your health? And begin to help them kind of open up and discuss that piece, because I think that's really important. So if you have a patient who may be being told that they have end-stage kidney disease, and that really their only step now is dialysis, that they're not a candidate for maybe a transplant, but maybe all they can really hope for is maybe dialysis 3 times a week. And so beginning to have that conversation. So what does that mean to them? What does going to a dialysis center 3 times a week mean for you? What does that mean about the quality of your life? Having those kinds of conversations are really important. Getting an idea of, what do you want? What do you need? And having them begin to express those kinds of concerns, maybe bringing family in as well. You have to kind of weigh that one a little bit too, because sometimes families' ideas of what they want for mom or dad or their family member are far different than what the family member needs. But really having those open conversations about where they are in their health and what do they need and what do they understand about what the doctor is recommending. Because sometimes the doctors will want to recommend, a new treatment regime, knowing that really the end result is that they're not going to survive, or that the risks, really are far worse than the benefits. But a lot of healthcare providers don't like to let go. So having that conversation, what are their goals? What do they want? for their life right now. Maybe it's just they just want less pain. Maybe they just want to be able to spend more time with their family, and knowing that going through a treatment program right now is just going to mean, that they don't get to have that quality time with their family. So I hope that answered your question.
Yeah, and I think that really that is the role of the advocate, is to help bridge that gap. So as professional advocates, I think that's an entryway into talking with family members. I know somebody who I'm related to, her mom and dad are, they're aging, and they both have their own separate issues, neither one of which feels like is a big deal, but together, co-caregiving and not being able to do certain things. And that dynamic is very challenging. So in terms of health literacy, just bringing someone on board to help kind of highlight where the most potentially dangerous situations might be in terms of safety, which is why we were so happy to be partnered with Campaign Zero on this particular webinar, because in the end, health literacy and advocacy is about safety also for patients. And Karen, do you want to say just a few words about Campaign Zero? And
yes, I would like to take a minute or two, but also leave room for other questions too. So I'll just be very brief. For those of you who aren't familiar, Campaign Zero, and our tagline is Families for Patient Safety, has been dedicated really to this mission of helping everyday people, all of us, who haven't had the benefit of going through medical or nursing school, to be able to understand, some pretty simple ways to be the extra pair of eyes, ears, and hands to support safe care. And we started with just giving out free checklists that people can download and grab them and go to the hospital when you get that call in the middle of the night that your mom has been admitted with a stroke. And it's like, okay, of course I'm going to go, but I don't know what my role is once I get there. Well, now I have these checklists. This is what I need to watch for. This is what I need to say. And this is what I need to do in order to support, not to take the place of nurses or doctors, but to actually support, as advocates do, that safe care and the best possible outcome. And we've developed several community education programs with this very same mission, where we partner with professional patient advocates to do community education. And we have about 40 now in most of the major US markets. We can always use more, of course, because there are just millions of people who need the kinds of information that Sue is sharing and the kinds of information that we share, just to feel comfortable managing their own healthcare. So thank you.
And I would say, Campaign Zero, Health Advocate X, we have licensable material for advocates to deliver to the community. So, go to our websites and check that out, or feel free to follow up with Karen or me after this presentation. I do have a question from Angie Farmer, who is a health coach, and she asks what the role of health coaches are. And also there's a college with online resources for those who are trying to stay physically and mentally active and engaged from age 55 on, wondering what would be most valuable to provide to increase health literacy in terms of what can advocates, health coaches be teaching in addition to the material that you just presented today in terms of keeping people mentally and physically healthy and active?
So I think one of the key components is really getting to know your clients. I had a period of time where I worked out with a wonderful personal trainer back in my day when I was much younger and had a little bit more free time. And I think one of the things that was really an important key piece to it was the relationship. I think, having a trusting relationship with your client will open doors so that you can begin to have those conversations about, do they understand, this new fad that's come out about, well, I don't know. There's so much out there every day. It's like I just my inbox sometimes is a little overwhelmed with, new fads of, take this vitamin, take this supplement. This will help you do this better. And when you get to that trust point, then you can have conversations about, that really isn't. There's no science behind this, and really beginning to talk to them a little bit more about the science behind why we are doing the things we're doing. Why is strength training so important as we get older? More than anything else. I mean, we all need to be lifting weights as we get older. And there's a science behind that and beginning to have that conversation. But I really think a lot of it is going to come with developing that trusting relationship. And I think as a health coach, that's probably one of your first things that you're trying to do when you are working with a client is developing that trust so that they feel like they can come to you and ask a question and not have you roll your eyes at them and say, well, that's really silly. And just recognizing that, what they're asking you is important to them. So, and I think that trust issue is there. One other thing that I wanted to say, which kind of builds on what Karen was talking about, is, being able to go out into the community and educate. One of the key people that you can partner with is your local librarian. Mm-hmm. Librarians are, they have a wealth of knowledge on how to use the internet and get information. And so, creating a relationship with your librarian to say, hey, I'm a health advocate and, I have a group of clients. I'd like them to come in. Can you show them, how to access some websites that we know are, good websites where they can get some health information, or can you help them find some more information about a particular disease process, and get them to teach them about the issue around health literacy. But your librarians can be a great partner for you. They'll also let you host little, talks as well. I know our local library here where I live in Sedona, they're all, prior to the pandemic, we're hosting different, talks and lectures. So, there are opportunities out there for us as advocates and as healthcare providers to be able to, spread this information that this is the new vital sign. And we really need to make sure that everyone is aware how important it is that we recognize that health literacy is really a patient safety issue. And, so I'm hoping that y'all got a little bit of, new information here that you can take it with you and spread the news. Robin is going to share my email address. So you're more than welcome to reach out to me. So that if you want to get some more information about, the health literacy role as an advocate, please feel free to reach out to me.
Absolutely. And I think one of the things that I love about this topic is for advocates to be able to normalize this idea of health literacy. It doesn't mean that people are dumb. It's that we need to every human needs to understand our own vital signs. And that's why I just love this talk. Sue, you did just such a beautiful job today. And Karen, thank you for the partnership and being able to co-host this today. I wanted to remind everyone that we will be sending out a feedback survey directly after this, and we'll include Sue's contact information and also an offer from Campaign Zero for their speaker series. And as always, we really rely on your feedback to make sure that we're presenting you and offering you what you want in terms of education, learning opportunities, and connection. So with that, I'd like to say thank you, and we hope to see you for Professional Health Advocate X members at our case review, April 7th. If you haven't already signed up, please please do so. And if you have any questions about that, email us, healthadvocatex@healthadvocatex.org, and we hope to see you soon. Thanks.
Thank you.
Thanks,
Thank you
everyone.
for hosting this Health Advocate X. We appreciate the partnership.
Absolutely. Have a great day.
Great.
Thanks, Sue.
Thank you, everyone.